Well, it's time for our viewers' favorite chat room monthly segment. Of course, we're talking about It's All About You, that segment with Dr. Marcia Byrd.
Well, today she's here to talk about a procedure that's become quite trendy in the cosmetic world. We're talking about Aqualipo.
Please welcome back to the chat room, Dr. Marcia Byrd.
Hey,
Thank
Dr.
you.
Byrd, it's so good to see you.
It's so good to see y'all too.
What is it?
What is it? Aqualipo is a very gentle type of liposuction. We use two modalities. We're using laser and water pressure.
Huh,
And
just flush the fat out?
It's very much like a pressure washer. You know how
a pressure washer.
Have you ever used a pressure washer before?
Yeah.
Yeah.
Okay. You know, the slower you go, the better the results.
Right.
And that's the same thing with this. So it's not that aggressive kind of liposuction. It's a very gentle liposuction.
Okay, Kimberly.
We need to
All
see
right,
it.
we got to see it.
We need to see
well,
it.
we got a chance to see this procedure with Dr. Byrd, so let's just take a look. Let's take a look.
Today we're going to do Aqualipo, which is a combination of laser and water-assisted liposuction. We're going to start by using the laser, and what the objective here is to do is to help smooth out the skin and to tighten the skin. This is a small laser fiber. There's a tiny laser at the end of it that emits a little red light so you can see just exactly where the tip is. We insert this through these little openings that we've made in the skin. The second part of this procedure utilizes water pressure. And what this pressure washer does is gently remove the fat. And here's the fat as it starts to come out. Very gentle liposuction. The advantage of this is that, number one, it's less traumatic to the connective tissue structures. We're not injuring the nerves and the veins as much.
That's interesting.
That is interesting. It
It
is
is.
like a pressure.
Yeah.
You were right. You
It's
were
very,
right.
very much.
So why do people like this kind of a procedure?
Well, because the downtime is much less.
How much less?
People usually go back to a desk job in a couple of days.
Bruising.
Bruising is minimal, very minimal. Sometimes we'll see a bruise, but it's very unusual.
And so what is probably a really good area to have this kind of
Yeah.
procedure?
You know, we can do it pretty much all over the body. We can
Really?
do the neck, we can do the abdomen, the
What
chest.
what do people most come to you and say, hey, I want Aqualipo?
Abdomen is the #1 spot.
And so so someone has the Aqualipo on the abdomen, and let's just say how much weight will they then lose?
Well, it's not about weight. You know,
What is it about?
Fat is, it's more about sculpting the body.
Got it.
It's not really intended for weight loss.
See, I like that idea. I think that, no, seriously, I think that, you know, no matter what size you are, if you are sculpted and you
That's
look
right.
nice, you know, it just doesn't matter. So I really like this procedure.
What about the cost? Because people always say to us,
Yes,
you didn't ask
yeah.
how much it cost.
The cost, say the average abdomen would be anywhere from like $25 to
25. No.
Wait a minute.
$2,500.
Oh, 100.
Okay.
I was going to say. I was going to make an appointment. I was there after the show. Okay, so
About
25.
$2,500 to around $5,000 for the abdomen.
And does it last? I mean, it's like lipo. It just.
Absolutely. I mean, the fat, once it's gone, it's gone.
Okay, so we got it. So we've got $2,500. This is not like some of the other procedures where you have to come back for multiple. This is it.
This is it. One-time procedure.
Now, do you think this will mean that regular lipo goes away? I mean, will this kind of take the place of the regular lipo? Because that was, you know, I got to tell you, regular lipo is pretty. I haven't done it, just for the record,
whatever.
but
She's a
I've
size
seen
4,
it. It's
she hasn't
like
done it.
it's really invasive. It feels like to me. But
Well, it's more traumatic.
Yeah,
You know,
traumatic.
Yeah.
You've seen it on shows like TV channels, you know, that
Right,
have these
yeah.
kind of shows, and it's very, very traumatic.
And this is not.
You don't need to be traumatic when you do liposuction now.
Yeah. Well, that Dr. Byrd, you
It's
know,
a lot
we love
easier.
you. You know, I'm telling you, we said for real, seriously, people, when they talk about the show, they're like, you know that lady that freezes the fat? I mean, there's still, we did that like months ago, and they're still talking about freeze the fat. Well, Dr. Byrd, thank you so much for joining us. We
Thank
just
you,
really
too.
appreciate you being here. And listen, we loved seeing you last month in your office, but please, we love being here. But can Kimberly and I come to the office too and play maybe
I
next month?
think we should do that
Can we
next
do that
month.
next month?
Yes, we
Kimberly,
should
are
do
you
that.
down?
we've got lots of stuff we need to do.
Well, can we just go in and just
Yeah,
have some
I'm
fun?
kind of scared, but
We'll find something that you can do with
You
us.
do it with me.
We'll find something, but y'all don't need much.
Oh, thank you, Dr.
We
don't
need to
need
either
much at
suck
all.
something out or plump something up. That's what I think.
Well, Well, you can contact Dr. Byrd anytime at the Byrd Aesthetic and Anti-Aging Center. And of course, you can check her out online at byrdaesthetic.com.
When we